This programme is about discovering and understanding what works best and changing what we do so that we can provide the best possible care and support to patients and those affected by cancer from the moment they come into our services.
I think this is a really fantastic opportunity to see what we can do to improve the cancer journey for all patients. For me, it's particularly around looking at early diagnosis, getting patients promptly into treatment, but also the support that they and their families need through what for them is a very difficult time.
It's a very ambitious programme, make no bones about that. And what we want in terms of the hallmark of the programme is to be person-centred and co-productive in its approach. Patients are really at the heart of this programme. This is not about doing to patients, it's about working with patients.
You've got to get on top of the whole procedure from seeing your GP and referral to actually having whatever treatment. Waiting as I did 7-8 weeks, not knowing what was going on and having to initiate it yourself was, in my view, not good enough. My wife was always accepted at consultations, but there was nothing beyond that in terms of understanding her role, or the significant other role, the partner role if you like, and offers of help to her and so on. Possibly if the whole thing is seen as something embarked on by somebody with a partner, as it were, there might be a bit more empathy.
It's like going to the cancer unit and having the biopsy, and then coming home with books and a folder. I didn't know nothing financially about grants which could help with the radiotherapy, and obviously having to pay the huge heating bills. Financially, that can really be a nightmare.
I would like the pathway to become much smoother for patients, to make the GP referral system simpler, to get the patient seen at the right time, in the right place and by the right person, and then improving the communication with the hospital to the GP after the diagnosis to allow us to support the patients appropriately.
The key thing is to look at the whole pathway and see where are we wasting time. Is it really necessary that a GP has to make a referral to a hospital consultant first, or GP can straight away ask for that diagnostic test themselves? So if there is a lot of time being wasted in that pathway, we can really cut short that.
We follow our patients up after the cancer treatments to make sure that we can detect any changes or any recurrence very early. The current follow-up model involves lots of visits to the hospital and long time with anxiety waiting for results, and the program is helping us to change that follow-up model to make it more convenient, faster and safer for the patients.
We've spent a lot of time as a health board reviewing the clinical nurse specialist workforce. What we've learned is that we need clear and consistent pathways of care, as well as defined roles and responsibilities. This programme will help us progress this work and support future developments like the introduction of skill mix into our teams.
Mae'n gwych i bod gweithio gyda'r Bwrdd Iechyd Betsi Cadwaladr eto. Ni wedi gweithio gyda'r Bwrdd Iechyd am blynyddoedd nawr a wneud gwahaniaeth enfawr i pobl yn y Gogledd mewn partneriaeth gyda nhw. Mae'r partneriaeth newydd yma, mae hon yn mynd i wneud gwahaniaeth enfawr hefyd. Ni'n mynd i edrych ar y 4 tiwmysau mwyaf sy'n effeithio pobl yn y Gogledd, a mae'n bwysig i ni edrych sut ni'n gallu datblygu hon fwyaf dros Cymru hefyd.
This is the first in Wales that looks at the whole patient pathway, from pre-diagnosis to diagnosis to treatment to aftercare and beyond. And I think that's hugely challenging and hugely exciting.
We are transforming cancer services together.
We are transforming cancer services together.
We are transforming cancer services together.
We are transforming cancer services together.